the first question I have for you, insulin medication and the affordability of it was a hot topic of discussion before the COVID-19 pandemic. And obviously, when we talk about the pandemic, we almost have to divide it into certain sections of time. But have you seen the pandemic impact the way that patients can afford insulin during this time, or has it remained about the same?
Yes, absolutely. I've seen changes. I think because there's been a lot of changes in terms of people's employment. People are losing their jobs, and so their insurance is changing. Some people had, they had commercial insurance and now they don't, or they're switching plans. And so that for sure is placing a toll, or even people with jobs, maybe they're not getting as many hours, they're not bringing in as much income, or they've been furloughed. And so they might have been able to afford their copays before, but now it's really a struggle. So I've absolutely, this has been a big issue during COVID.
And now, for those patients who maybe this is the first time that they've really run into serious trouble being able to pay for their medications or their insulin, what are those conversations like for you as a clinician, and how is the best way to navigate those conversations? Because I imagine they can be incredibly stressful for a patient to have to approach a doctor about that.
Yeah, I mean, I just make it part of my routine visits. I'll say something like, I know insulin can be quite expensive. Can I ask, what are you having to pay each month? Are you, having any difficulties paying for your insulin or your medications? And do you ever feel like you need to take less of the prescribed amount to conserve your insulin or your medication? So just open-ended questions like that to just, really normalize the topic. And I think one of the good things is we have seen this issue really come to light, like in social media and the news. So I think it's a very normal thing to talk about this, that insulin is expensive. And even if you do have money, no one wants to be spending all of their money on their insulin.
All right, thank you for that. And now, as we sort of seen, as you mentioned, a bit of an increase in people being worried about affording their medication, have we seen any implications of that? Have you seen an increase in, say, hypoglycemia or anything like that among your patients?
Well, it's hard to directly link. We're seeing a lot of changes with COVID. People are home more. In some ways it's helpful because they have kind of more structured routines. So they're having less variability. But in other ways, we see some people are eating more, they're gaining weight, they're actually having more hyperglycemia. I've certainly seen situations where people have had to go to the cheaper form of insulin, like NPH and regular insulin, which we know the pharmacokinetics aren't as good as some of our newer insulins. And so they are at higher risk of hypoglycemia. And sometimes that does happen. So I think it's pretty variable. And then also I have seen people just stop their insulin completely, which of course is not a good situation and leads to excessive hyperglycemia and can lead to hospitalization. And so, I've seen a lot of different types of consequences occur.
Thank you for that. And now, one of the things that have seen in past research into the affordability of insulin is that, excuse me, a lot of the measures that have been taken in the past to sort of address the need for more affordable insulin have fallen a bit short of helping those who need help the most. Do
Mhm.
you think that this is something that we're seeing have sort of a ripple effect in the current time, or is it just sort of business as usual? It's equally as hard for them to afford insulin now as it was before.
So I think we've seen pharma, do some things to really try to help. For example, Lilly recently, offered this $35 copay program for people with commercial insurance or people who have no insurance. So it's $35 copay per insulin. Novo and Sanofi have, similar types of programs. Theirs are $99, but offer a little bit different in terms of how they structure, where you can get two different types of insulins. Novo has a one-time, emergency 90-day supply, option for people that are really struggling and trying to figure out, how to get into a program. So there are options out there, but I will say it's a little difficult to navigate for the average person. It's not like, there's not like a how-to guide. It's like, it can be a little challenging. And that's where I think meeting with a knowledgeable clinician or diabetes care and education specialist to help the person navigate these programs is really needed.
And now let me ask you from a medical education perspective, the COVID-19 pandemic has been sort of a blessing and a curse in that people, the layperson is very interested in healthcare all of a sudden, or has a heightened interest in healthcare. And a lot of doctors for years have been wishing that patients would take more of an interest in their day-to-day healthcare. What's it been like for you as someone involved in medical education, specifically diabetes, to see sort of this giant push among the everyday person in interest in healthcare, and one that for a lot of people has sort of steered them the wrong way, I guess you could say? What's it been like for you as a medical educator?
Well, I think one of the great things that has come out of COVID is that um, we've really expanded telehealth. And so now we're doing tons of visits like this, through Zoom, through virtual platform. And it's so much more, I feel like the healthcare team is so much more accessible. So, I'll like send a message, or a patient will send me a message through our electronic medical record and say, I'm struggling with this issue. And we can immediately set up a virtual visit later today. And more people are home. So it makes it easier to connect. So in that regards, I think that has been really wonderful. I think, of course, people have to go to reputable resources. And so we want them to come to, people like me and the healthcare team. We know that there's a lot of kind of misinformation out there that people can find. And so it's more important than ever that they are connecting with their healthcare team and with knowledgeable healthcare professionals, and not just like random people expressing their views about things.
All right, thank you. And yeah, I think that misinformation has been abound during this time period, unfortunately, but also a ton of great information has come out. One of my last questions for you, since everything that's been going on during this COVID-19 pandemic will likely in the future be looked at under a microscope and really examined how we handled things, do you think that we could see any reform coming out and for further reform coming out in regard to the affordability of insulin? I think the current time period has really highlighted just how close many people are to not having a job or being in a position where they might have difficulty affording medications. Do you think that this will sort of shine a new light on that as we move forward beyond the COVID-19 pandemic, whenever that occurs?
I sure hope so. So I think it was encouraging that recently, they're trying to reform the Medicare system to have $35 copays for people with Medicare. And that is so badly needed, because my Medicare population is one that struggles the most, because they're not eligible for the commercial programs. They can't use the copay cards. And many of them fall into that donut hole, or that coverage gap, where they're having to pay astronomical amounts for their medications. So I sure hope that we need the reform. There's no reason people should be having to pay a ton of money for a medication that sustains their life. I mean, we can't be denying them, that medication. So I am hopeful that this will shine a light on it. I'm also hopeful that telehealth will, continue to be the wave of the future, and that hopefully this means it will be reimbursed also by Medicare and other insurance companies, because that's also needed to make it sustainable as well.
All right, and now, just before I go, is there anything else you wanted to add in regards to the current landscape of the affordability of insulin or medication during this time period that I might not have touched on?
Sure. Well, I wanted to share, I worked with a team with the Association of Diabetes Care and Education Specialists, ADCES, on an insulin resource guide. So basically it takes all the different programs that are out there, like the copay cards, the patient assistance programs, as well as, some of these newer programs like the $35 program and the $99 programs that some of them are offering. And it's all in one space, and it helps people, I think, to navigate which type of patient is the best match for each type of program. So I'd encourage people, to use stuff like that, as a resource to hopefully be able to help patients navigate, because often there are a number of resources, but sometimes it's really challenging getting that resource to the person that needs it.
I totally agree. I think one of the biggest hurdles for a lot of people when looking to afford medications or finding cheaper medications, sort of like your Medicare patients that you mentioned, is accessibility. A lot of times things aren't aggregated in a simple online source like the one you mentioned. So thank you for mentioning that. I'm sure our audience will appreciate it. But that's about it on my questions. Thanks for taking the time to speak with me today. I appreciate it.
Great. Thanks for having me.
Thanks.